I'm Brett Yoder. I'm originally from just south of Akron, Ohio. I went and did my undergrad at Ohio Northern. Then I went to uh, University of Pikeville for medical school. Then did my residency in Moorhead. And just completed that. And now I'm over at the Cedar Knolls Clinic. I see anybody from basically from birth until the elderly. And then I also offer OMT. A lot of people haven't heard of it before. Usually what that involves is we sort of look at the spine. Usually it's back issues. We can look at the spine, or we can look at the legs or the arms, or even the neck. We sort of see what your body's allowing you to move and how you're able to move. And then we sort of try to increase that movement. So I work Monday to Thursday, and that's 8 to 5. I also do walk-ins, so if you just show up 8 to 5 o'clock, I'll see you whenever. We don't turn anybody away. If you need something that's acute or something that's been there for years, we'll see you regardless. I wasn't always wanting to be in the medical field. I grew up, my parents were foster parents. And I think seeing a lot of those kids, and a lot of them had like cardiac conditions and breathing issues, and so we would end up at the doctors a lot. The biggest thing that I would see is that they'd go over and over, but it just felt like you were sort of going through the motions, and you were just another patient, and you were just being seen because you had to be seen. And so when I became a doctor, I sort of wanted to do it a little different. I look at everybody individually, but I think the biggest thing is we need to be doing what we can to sort of prevent chronic illness. The biggest things that have been going on for years and years, obesity is a big issue, drugs, alcohol. And so we're trying to address all those things, and we want to try to get ahead of sort of the chronic issues that can occur with those. So I like to talk a lot about diet and exercise, different things that we can actually recommend and we can actually implement into our lives. I think the most that I enjoy is sort of seeing how they progress in their care. My biggest satisfaction that I get is getting a person to where I only have to see them once a year. And usually that means that we're doing something right. That means we've done all the preventative stuff, and we're not checking up on anything. We're not having to follow your diabetes really strict or your high blood pressure. We have everything under control. And I think that's one of the biggest successes you can have as a family practitioner, is that you're seeing these people and you're only having to see them maybe every 12 calendar months. Because life's going well, and you're actually out there able to live your life, and you're not sort of having to see the doctor every couple months.